Joe,
Yeah.
I'm gonna take a minute first, actually, to embarrass you. Um, we've we met over a decade ago.
hmm
You ended up becoming my supervisor at the studio on the men's team. Um, but yeah, I've known you in the field of recovery for over a decade, and to the point where I've sent loved ones to you for help. Um, and when I talk about you, I say, of anyone I can think of, you know the big book more than anyone I think I've personally met. Um, and I've heard you speak that way of other people, um, the mentors that you have. But anyway, so we've talked about this for a while. I'm just
hmm
absolutely tickled for this opportunity to chat with you, to visit with you, and to start up these discussions and these shares as we dig into addiction recovery and sharing the message. So, will you take an opportunity and explain who you are and what we're doing here?
Sure. So, my name is Joe Elder. I'm a therapist in private practice here in Spanish Fork, Utah. I've had the opportunity to work in addiction recovery treatment for over 20 years. I'm also a man in recovery from alcoholism for over 20 years. And I've had the opportunity to really have a very unique experience in that I believe my journey into recovery was like going to graduate school and getting to know the best and the brightest minds in addiction recovery. And I had this opportunity in the treatment center that I first started working at. I, I was almost done with my graduate degree, and they didn't have any counseling positions. So I had this opportunity to start out at the like literally at the PRN level where they'd call me in for a shift, and I literally started to get to know the organization of a treatment center from the very bottom stage of like employment. They'd call me in, they'd ask, "Hey, we need you for this shift. We need you for this shift." And I slowly, over a 2-year period of time, really learned the business inside and out about like literally being like a frontline staff person, learning all the ins and outs of like the extent of like what detox looks like, what they're going through, getting to know the family process from a non-clinical point of view, and then getting the opportunity to then become a counselor and actually starting to really notice and see the deficiencies in the field, but then also utilizing the contacts that I had about making sure that those deficiencies were at least well enough to explain to the point where the 12-step model was the model that I was trained in and I was working and that I personally believed in, that would transform people's lives from a state of complete dependency on a substance or a behavior to getting them free from that. From that point of view, I then worked for 15 years as a therapist, just really effectively working with clients, their families, clinicians, and referents all over the globe to help people that were struggling with this disease. And it's my personal mission to help people understand that there is relief from addiction. I just don't want to do it one client at a time. There's too much of a need with kind of where we're at in today's society to where I want to really have my voice be heard from as many people as possible to help them understand these principles to get well. And that's the reason most of my career has been spent like literally doing drug and alcohol work, because I personally not only made covenant with my higher power, God, to do this. But I believe my life has been specifically impacted by the experiences I've had that continue to help me maintain my recovery. And the message that I have is that recovery doesn't have to be complicated. It just needs to be exercised like you'd go to a gym. You have to be very consistent and committed to it, and it just doesn't stop. So, a little more about myself. I'm not originally, although I work in Utah, I'm not originally from Utah. I'm actually a Texan. I was born in San Antonio and I was raised in Texas through most of my grade school years, and then had an opportunity to move out to Utah with my family, and I've been here ever since. So that's a little bit about me.
Awesome, I love it. I didn't know that about the PRN gig. Is that where we worked together?
Mm-hmm.
That's how at least the last time I was hired on there, it's the same way. So hired on as a PRN, and then once that position was available, it was the right fit. So anyway, I love it. We're going to bring perspectives and some content centered around recovery, heavily 12-step based, deeper than just reading out of the book, deeper than just looking at the catchphrases, the cliches that we hear in the rooms. We're going to, part of our intention is to dissect some of those things, interpret some of those things, not necessarily to tell somebody how to think or how to personalize it and individualize it for them, but maybe to clarify. You have a great amount of knowledge and understanding about Bill Wilson and his perspectives and maybe frame of mind that many of the fellows that struggle today would miss out on, I think. And so we're going to dissect some of those things. We're going to dig a little deeper. I think we share a level of discouragement that recovery rates are dropping, have dropped significantly. In our field, we used to talk about a 30% success rate, and we were already acknowledging that bottom line just sucks. That's horrible. Why would we celebrate that when it's only 30%? But we kind of understood the nature of addiction, how powerful, how compelling it is, how controlling it is, how it reoccurs, how it's not somebody that is recovered and is all better now and doesn't have to address any of this, but that we're in the process of recovering. And I love that phrase, do your dailies. I love that concept of, these are the things I'm doing today. I'll have people ask me how much time I have, and I used to love saying, well, I've got 2 years, I've got 3 years, and now I've got 5 years. And then in my past, there were times where I'd have an amount of time and I'd obsess over that to the point where I lost sight of why I was sober that day.
Right.
And so now I look at it from the perspective of, it's if somebody asks me, I have to actually think about this, like what's today, what's the date? I have to calculate different things. And so today is the most important, is the most crucial thing. I can't control what's going to happen tomorrow.
Right.
I have some influence over it, certainly. But I've got to be in a position today where I'm clear, where I'm present, where I'm doing those things that are aligned with my values, so that whatever stressor comes into my life, I can navigate through it, right? And so, as we've talked quite a bit, we want to remind people, people in recovery today, maybe a little bit more about the founders, the principles that were initially implemented,
right?
And getting back to that. So we talked about calling this podcast Back to Basics. And I know there was a workshop that we used to be involved in called Back to Basics, and it's one of those phrases that's a common phrase, but literally that concept of, let me get away from this fluff, all of the extra stuff that's out there in this world, the distractions, and get back to those core principles and aligning my actions with those things.
So if I could just touch on what you just shared about the whole concept of time, you know, I I don't talk about this a lot, but this becomes kind of a really back to basics concept. It's like I only have today. Okay. The beautiful thing I love about AA is it does a wonderful job at celebrating milestones, like specifically time. You know, the newcomers come in, they if they're open for it, they get a chip. Okay, that's not a lightweight deal, but those chips just don't end after say 24 hours or like a month. You know, it goes on. Okay. I have at this time a little over 22 years. I'm working on my 23rd year of recovery, but that is just that's kind of a reminder that I've invested time, okay, in learning how to give myself a daily reprieve contingent upon one standard, and that's a spiritual reprieve from the obsession of the mind. Okay, that that whole piece is just a daily work. Okay, so if somebody got up before 6 o'clock today, they have more time in recovery than I do today. I I don't like to toot the horn that time is the culmination. Okay, the big book talks about this, and I love this concept. Is it quality of time or quantity of time? And when people start focusing on the amount of time they've collected, what I've noticed in this thing called recovery is you have an ability of others, if that's what your focus is on, of losing track of what you have to do today. Mm-hmm. And for me, I've just learned that it's not about how much time I have. It's about the quality of the time that I put into what I'm doing today, because that's the measure of what I'm going to get out of it. So for me, I encourage people to be very, very careful about looking at it and talking about time in the concept of accumulating it, where the most important thing that we have really is today, and how are we using that in a way that not only benefits us, and this is the critical part, because this is the back to basics principle. It's like, and for others, you know, and for me, you know, that is one of the foundational principles that we really need to start focusing on again. Is what's the most important thing that we get to do, and that's like we get to actually manage our time in a way to maximize the benefits that we have today. And for me, some of that's recovery oriented, some of that's family time, some of that's my professional self, but a big part of it is actually being able to be here today and start working on this development of this goal that we've had about being able to start sharing these concepts. So I just wanted to touch base on that, because that's a personal belief that I don't think is emphasized enough in the recovery community.
As you were saying that, and I did some self-reflection, maybe even, do we wear a badge when it comes to, I got my 30 days, or I got my year, or I got my 5 years, is that what we kind of rank our recovery on? That now I have this time, thus I must have really great recovery.
Right.
As opposed to, you know, and I'll tangent for a moment, knowing people, other people who've had a dozen years, 20 years or something like that, but they were miserable in life. And there's that idea of, well, at least I'm sober today, but like, in working in the rooms and working in treatment and all of those things, I'd have newcomers who would say, if that's what recovery looks like, I don't want it. Right. That person looks miserable. Yeah. They're grumpy, they're angry, they're critical of everything. And if that's what you guys are selling, right, I don't know that I want that. And so I think there may be that insecurity, or that something lacking, something missing, or us feeling overwhelming guilt and shame and things that way, where we go, here's my struggle, but I've got 30 days, but I've got this amount of time, as opposed to, what are you doing today to continue that work, to continue that improvement, right? And especially, like we've talked about a great deal, sharing the message with those who are still afflicted, still suffering, lost, wandering, whatever terminology we want to use, but being a beacon, being a catalyst for that change.
I like the concept that they're lost, but I'm going to also emphasize the fact that being lost also, a large part of it has to do with misunderstanding. And that's really one reason I've talked to you so clearly as I have about really emphasizing the importance of actually creating this podcast specifically to start addressing the underlying issues that are predominantly being the stumbling blocks for a lot of newcomers getting into recovery and not understanding or misunderstanding what they need to do so that they're not like white knuckling it, and that they can be happy instead of like grumpy and going to meetings and just having that storm cloud and that burden hanging over their head and just like, I'm pissed off and I'm angry and I've been this way for 5 years, but at least I'm sober. It's like, that's not what 12 steps is about. That's not what recovery is about. That's not what the whole purpose of the treatment industry is about. I don't want anybody to suffer anymore. That's somebody that's suffering. Okay? That's not what recovery should ever be assumed that that's what it looks like. We have a whole process of steps 1 through 12 that are specifically designed to help any man or woman go through a process of learning how to let go of all of the things that create that burden and unload it so that they can have a new happiness, a new life that's free from the burden of the patterns of the way they used to think that was self-destructive. And therefore, that also will also change their behavior. It will also hopefully include bringing other people into their life, being open to creating a new network of friends that will also transform their lives and their behaviors and the way they think. It's not just a singular program that was established to just say, okay, just stop drinking, just stop doing drugs. It's bigger than that.
I agree with that wholeheartedly, and I think, as you said that, I'm thinking about the other things, the other areas that this touches, the other areas of life where it's not just someone got sober and the problems went away. It was, no, this bled over into their profession, their vocation. This bled over into, like, the problems that come from this, over into relationships, parenting or spousal relationships, neighbors, friendships, and those kinds of things, affiliations with someone's religion or whatever else it is. Someone who's truly addicted, somebody who really has the disease of addiction, isn't navigating this recreationally.
No.
This isn't something that's just, today I'm doing well, and we'll just keep going, with our fingers crossed or knocking on wood or whatever. The word painstaking, I don't know that I've ever heard that word outside of a recovery oriented.
I've never heard it outside of recovery.
Right? And so I hear that and I'm like, painstaking, wait a minute. Does that mean this is going to hurt? Does that mean this is going to be miserable and complicated and all of those things? And there's some complexity to it, And there's the distinction between something that's easy and something that's simple.
Right.
And for a long time, I've viewed recovery as a very simple concept.
Yeah.
But so hard, so incredibly difficult to do. Because the concepts are, like you said, here are the steps.
Yeah.
It's all spelled out. Here are the tasks to do, right? The application is difficult.
Yeah.
Especially if I wake up and I'm grumpy, or I'm hungry, or all the acronyms that we use, right?
Yeah.
And I'm thinking about one of the things we'd tell our clients: don't get into a new relationship, in the first year of your recovery. And people would fight that all the time. Absolutely, I get it. Why? You don't want me to be happy, or you just want control, or whatever else it is. My response would be, think about like the 3 most successful relationships that you've had in your life. And even those, how complicated were they? And most people's response, it was hard, and there were some really hard times, and there were some whatever else it is. So imagine trying to do that while simultaneously trying to stay in sobriety.
Right.
and navigate the stresses and the worries and anxieties and even the celebrations that come with relationships of all kinds. You know? But just try to stay stable and sober and all of those things. And so, yeah, it's a simple idea, but it's very difficult to implement and then to maintain, at least without support.
Well, the difficulty, you know, and I totally agree with the support aspect of it. Is like it is so much more of a challenge and a difficulty if you don't have a support group to actually also walk with you and carry you through the burdens of what you're faced with. Okay, a big part of recovery, and it's not that complicated, but it's incredibly difficult to apply it. It's like, do you want recovery? How much do you want it?
Yeah.
Okay, and then how often do you want it? You know, and it's like we don't typically have those conversations. It's like some people will roll out of bed and they're like, man, I love my day, I want to be in recovery, and then other people will roll out of the bed and like, dude, I just absolutely want to get just lit, and I love playing with all of that. I even love playing with the idea that, you know, when a client will come to me and say, "Oh, you don't want me to be happy. You don't want me to have a life. You don't want me to date and all this other stuff," and I'm like, I'll joke with them and I'll say, "You're right. I don't." You know, and then I have to actually go into the bigger questions like, okay, but do you know why? Do you know what's going to happen if, say, you do date and your focus gets derailed from, say, the development and an understanding of the things that you don't understand, okay, compared to the things that you just want, okay, and it's always about coming to an understanding. We have a responsibility in this field to encourage people to start looking at all of the dimensions of their life, what's working, what's not working, what needs to be the focus, okay. We hear the statement all the time, first things first, okay? It's like we don't do a really good job, okay, in the treatment industry per se of really focusing on what does that mean? You know, and encouraging people like literally to introspect and say, well, what is it I really want and how do I actually get it? You know, what the industry does, and I've seen this in multiple places I've worked, is like we'll throw the big book at them, we'll throw step work at them, we'll do cognitive behavioral approaches, you know, we'll do didactic behavioral therapy, we'll throw a lot of these theoretical concepts and ideas to them, okay, and say this is going to get you in recovery. But what is also missing there is the invitation, okay? Why do you want this? Okay, what's really keeping you in your seat? What's going to keep you going to a meeting every day for 90 days after treatment? And then what's that going to look like for the next 365 days after that? The industry as a whole needs to start really opening itself up to introspecting itself and saying, okay, what's really working for us? What's not working for us? And how do we actually change it to a model that will incorporate getting more success, okay, through the techniques that we're using to give people the skills that are ultimately going to be the product that we want to have them live by. So in the development of where we're at today, I see exactly a large portion of the populace that are addicted, that are in treatment, they're not challenged, they're not asked those questions, and you know, the biggest driving force is why, and a lot of it's not coming from within, it's coming from without. It's like, well, mom and dad said I had to do this, or I got a nudge from the judge, or you know, I was told to do this because, you know, I'm going to get something, you know, out of this other than, you know, going to jail or being incarcerated or, you know, having to continue to not have the support that I want from, say, this group or my family. And we're losing people because we're not really emphasizing that that critical question of why are you here, what is your plan, and then what are you going to do after you've completed this journey called treatment. Okay, the the real the real struggle for most people is they don't go in to treatment other than with this idea of I'm going to get clean and sober. Okay, treatment isn't about getting clean and sober. Treatment is literally about stabilization. How do I temporarily stop the disease from progressing? How do I actually start educating myself about what are the patterns and the behaviors in my life that continue to get me sick? And then once they're done literally with treatment, then the encouragement is that, oh, by the way, there's more. Okay? And some people will do it, some people won't do it, and some people don't even have a clue of like what that looks like. They're told about it, and maybe they're not even told about it. Maybe they're just told 30 days is enough. And then they think they've quote unquote got it.
And there are those times where, hey, just go to treatment for 30 days.
Right.
Because that's all somebody will agree to. Or
right.
somebody will agree to a week. Right. We know the resistance, we know all the justifications and the reasons why I shouldn't go to a treatment program or anything else. And so it can feel like a bait and switch kind of a thing. But what I'm hearing you say is, oh, so I just don't go get sober and then my problem is solved?
Right.
I've got to figure out how to stay sober.
Mm-hmm.
I've got to figure out how to continue my recovery.
Right.
Continue in my recovery.
Right.
To strengthen it, to improve it, to enhance it, and all of those things. It's not an event that just happens and takes place and I get a badge, I get a certificate, there's a commencement.
Right.
There's more to it than that.
Well, if I have a medical condition that requires, say, medication, and I don't take that medication, and it's known to actually create more problems once I stop taking the medication, and that the disease will progress, okay, then I've got a reason to start taking medication and be consistent with that medication, okay? That same concept absolutely applies to addiction. We have a physical disease, okay? And it's a chronic progressive disease that only gets worse, never better, unless it's treated. And treatment, and that's where a lot of ideas around what it looks like and what it is failing us and failing those that are going to treatment. It's like treatment is not just about going to a physical place, learning skills, and then applying them for a short duration of time, which is like 30, 60, or 90 days in, say, a residential program, or some programs last as long as a year, and then just having this idea that, okay, I'm sutured up, I'm bandaged, I'm stable now, and everything's fine. Okay, that's the initial work of what treatment's about. It's about stabilization. It's not about course correcting. Course correcting is then taking what you've learned from the treatment experience, properly applying it, and getting the benefit. Okay, and that's really the driving force for me. Is we're missing people in that, and we need to give an invitation not only to the treatment industry, but also to the clients and families that are looking to get into treatment, how to make that work of going through treatment, of creating a plan, and then applying it properly to get the result, how most effectively to streamline all of that and get the results that you want. The biggest problem is that we're not encouraging people to understand that treatment is a process just like taking medication. It's an ongoing process, and it's something that should not end. And I'm seeing too many people that when they get done with residential treatment, they have the initial drive, they have the initial understanding. They start on the journey of like taking that acquired knowledge and applying it, but very, very quickly afterwards, you see so many of them stopping what the journey requires for them to treat their disease, and then the disease resurfaces. Mm-hmm. So we're seeing a greater resurgence of people going to treatment, multiple times. When I first started in the industry, I could literally work with people that just had, say, a substance abuse disorder that didn't have any mental health issues. Okay, I don't see that anymore. I mean, none. I mean, we're talking if it's anxiety, if it's depression, if it's an underlying mental health condition that's also affecting the substance use. Okay, that's everywhere now. Whereas when I first started my career, I literally could have people come in that were very straight-laced, very solid people that had a substance abuse disorder that didn't have a lot of the underlying things that now drive most of addiction. I'm not seeing any of that nowadays. So the problem is becoming more acute, and therefore the message needs to really be doubled down on, okay, these are the things that are successful that we know from research and from application work. And that's my hope of what the podcast is going to actually help people understand for anybody that's suffering from this terrible, awful disease called addiction. And for those that live with them and love them on what they can do so that they don't suffer as well.
That this doesn't have to be the end. That
Right.
It doesn't have to be. There's a diagnosis of substance use disorder. There's a co-occurring disorder, whatever it is. It doesn't have to be doomsday.
Right.
This can be managed. It doesn't mean it's going to be fixed and it's going to be simple or anything like that. But there is hope.
Right.
Right. That's one of the messages that we have been talking about for years and years, is that there's a way to get out of this. There's a way to handle this. There's a way to live a wonderful life,
Right.
a successful life. We've encountered people who are incredibly successful in their profession, in their families, and something occurred to lead them down this path, and they needed some support. And now with that support, with managing the illness, they get to go back to life, and it's different. The operations are different, but can be successful. I worked in a facility, a mental hospital for a time, and part of my responsibility was to help people stabilize and then return to the court system.
Right.
Who would then determine them to be competent to stand trial for whatever had brought them my way to begin with. And most of the time, that stability, that stabilization came from good sleep, good nutrition, medication,
Yeah.
psychiatric care, and some education. And they'd get back on their feet, and they'd oftentimes would get out of the facility. They'd be out on their own, maybe probation or something along those lines. Some kind of supervision was still involved. But there was this feeling of, when they would come back, there was this feeling of, I got out, I was feeling better, and I kind of looked at that bottle of pills and I don't need these anymore. I'm feeling good. So they'd throw them away.
Right.
And the days would go by, the weeks would go by, and they'd decompensate. The illness, the mental illness, whatever the struggle was, would resurface, would worsen, and they'd return to a similar behavioral pattern that got them working with me in the first place.
Right.
And it became this revolving door of, as you're saying, people getting out of treatment centers going, I feel good now. I probably am not an addict. I'm probably not an alcoholic. They may have just
They brainwashed me.
They exaggerated this,
Right.
and I'm good. I'm not this way.
Right.
And so I don't need the meeting. I don't need the sponsor. I don't need the medicine. I don't need the big book or whatever it is. Whatever that concoction is that got that person well. I don't need this anymore because I'm stable, without realizing that that's what keeps them stable. That's what's keeping them being successful.
Right.
Is that foundation, those principles, right, and all that work.
And that really becomes kind of a very important piece of why this information needs to get out to as many people as possible, because the mental illness is also driving the issues related to substance abuse. to a much deeper level that then requires deeper levels of commitment and changes of behavior consistently to actually address it and have skills that can really be acquired, okay, to change the outcomes, to assist them to have a higher quality of life wherever they find themselves in, and to also allow their loved ones to have a higher quality of life, which then can actually help in developing a happy lifestyle for those that are suffering with the disease and those that suffer with those that have the disease. And for me, that becomes kind of our invitation is this is just like work and recovery. This isn't going to be something where we do a podcast once. This is going to be a podcast where we're looking at all of the developmental strategies and techniques that are being applied today. What's working? What isn't working? What do the current issues that the clients that we see, what are they dealing with? And how do we also help the families develop awareness and the clients that we're seeing to get into that state of health and well-being and self-care?
I love that invitation. I love that implied. This isn't a one and done thing. This is an ongoing process. It's an ongoing concept, and so I'm really looking forward to the discussions that I anticipate us having, the knowledge, the education that you'll bring to this space, to our listeners, to our clients, and seeing where this journey is going to take us. Yeah. Thanks for sitting down. Thanks for being here, and for the work that you do. It hits home for me.
Yeah, and thank you for the opportunity, because, I mean, this relationship that we've had for over 10 years, it's not changing, you know, and you've been a beacon of light where I've even sent clients to you, and I know the work that needs to be done, and there's not enough of us to assist in that work, and that's why this podcast becomes really an important part of like addressing the outlying issues that are not only in our community here in Utah, but also are actually presenting themselves throughout the entire world.
Right.
Because these are worldwide problems. It isn't just centered here in our community or in the United States.
We've talked for a great amount of time, I think, on, you know, we can bring a client into our office and spend, 55 minutes with them or whatever it is, and have a good impact on that person and give our all. Group therapy, we can bring in 8 people or 10 people or 12 people.
Yeah.
And it's maybe diluted a little bit, or the attention or something like that, but we're helping more people. And our hope with this is, can we share this message with people on the other side of the country, people in other countries that, for whatever reason, would never go to therapy or counseling, would never set foot in a meeting, would never acknowledge that there's a problem, right? But they can hit play.
Yeah.
They can just listen, and hopefully it touches somebody's heart in a way that leads them to take the next step, wherever they're at on this journey.
Right.
Whatever that looks like, whether it's 20 plus years or whether it's, I'm going to go pour this down the drain now. And I'm going to make a commitment to myself and my higher power and anyone else.
Right.
And so I love the idea that all are welcome, and our hope that all will benefit in some way.
Right.
So,
Well, thank you,
Gerald.
Chris.
We'll talk soon.
Okay.